This brilliant doctor has autism. The girl was just complaining of stomach pain, but he ordered 18 tests. Her parents were arguing nearby, believing their daughter was faking her illness to avoid going to school. At this point, the chief physician approached, thinking Sean was overreacting, and took him out of the ward. The chief believed the little girl was faking her illness because her parents were always arguing. However, Sean remained cautious, suspecting it might be intestinal malrotation, which could be fatal if left untreated. However, the chief physician insisted on discharging the girl. The head nurse, standing by, also mocked Sean. The chief physician simply had the head nurse supervise Sean, forbidding him from ordering any unnecessary tests. But Sean still quietly had the test done after the girl was discharged. Even the lab technician advised him that ordering so many tests for a stomachache might get him into trouble. But Sean remained adamant. When the test results came back, the lab technician told Sean that all the indicators were within normal ranges. However, Sean immediately noticed that the lactate and amylase levels were slightly elevated. Given the girl's young age, the normal values should be lower. After looking at the results for a moment, he hopped into a taxi and drove straight to the girl's home. He knocked on the door forcefully and stated his diagnosis. But the girl's father refused to believe a doctor with autism. Sean was still explaining the urgency of intestinal malrotation, but the girl's father was about to close the door and leave. Sean urgently said that his daughter might die. The girl's father, upon hearing this, angrily called Sean a freak and closed the door. Sean persistently knocked on the door again. At that moment, the girl's mother also came over and asked why they hadn't sent Sean away yet. Sean looked at them and said that he was a freak. Therefore, he would keep knocking on the door until he was sure that the girl was okay. The girl's parents had no choice but to take Sean to the girl's room. However, they couldn't wake the girl, who was already unconscious. Seeing this, Sean quickly picked up the girl and rushed to the hospital. On the way, the girl's condition worsened, so he immediately performed CPR on her. Upon arriving at the hospital, Sean continued resuscitation efforts while reporting the girl's condition. He then used his special skills to successfully locate the source of the girl's illness. Through surgery, Sean successfully saved the girl's life. Looking at the family of 3 in the ward, Sean felt only relief. The girl's parents were deeply grateful for Sean's sense of responsibility.